Today's Health Talk question is, what is the difference between type 1 and type 2 diabetes? Well, I think we went over that a little bit, Nancy, but maybe you could review again for our viewers at home. What's the difference between them?
Sure. So type 1 diabetes is thought to be due to a problem with autoimmunity, which means the body's making antibodies to the beta cells in the pancreas that make insulin. Classically, it occurs more in children. Type 2 diabetes is thought to be more hereditary. It also is related to obesity, and it is really a matter of not having enough insulin because there's a lot of resistance to the insulin. But to give a more holistic approach, we now have children that have type 2 diabetes, and we have plenty of older adults that develop sort of a classic autoimmune picture. So it's really much more of a spectrum and not just kind of two separate entities.
Is there a way you could say absolutely someone has type 1 diabetes if they get diabetic ketoacidosis or DKA? Does that mean they're type 1?
Well, that is a good way to do it. That's sort of a clinical diagnosis. The other way to do it is to measure antibodies, and there's a few of them that we can measure to determine that. And sometimes we do that when we're not sure.
We've got just a few seconds. Do you ever see a vaccination available that may prevent type 1 diabetes?
Well, that's very interesting. Up until now, I don't think the studies have been that promising for it, and there's been a lot of research. So I don't know.
It's not in the immediate future.
I don't see that, but I guess we can always be hopeful.
Nancy, thank you very much. This was a great show today. Really
Thank you.
informative.
Thanks for having me.
Very, very exciting. So if you at home have a question you'd like to ask me on Health Talk, please contact me at healthtalk@norwalkhealth.org.